Kluver Bucy syndrome is caused by lesions in bilateral medial temporal lobes in the region where the amygdala are located. These patients can present with symptoms such as hyperorality, putting objects in their mouth to sense them. They can present with compulsive eating and compulsive behavior. They can present with docility, also called placidity, and what that is less fear in a anxiety-provoking situation. For example, they can approach fire without showing any fear. They can also present with a phenomenon called hypermetamorphosis. Hypermetamorphosis is reacting overtly to visual stimuli. They like to see everything in their visual field kind of closer and interact with it and touch it. They can present with hypersexuality. The other symptom is amnesia and memory deficits, as well as visual agnosia. Now, what are the causes of Kluver Bucy syndrome? First of all, it's a relatively uncommon presentation, but the most common cause of this disease is infection of the brain with herpes simplex virus. So herpes simplex encephalitis, causing bilateral inflammation of the temporal lobes. It can rarely be caused by a stroke. Typically, if the top of the basilar is closed, it can cause bilateral PCA infarction. That's not very common. Another relatively common cause of this disease is trauma. So damage to, say, in coup, counter coup, neck and head trauma, causing damage to the temporal, the anterior poles of the temporal lobes, causing this syndrome. There are other infectious causes such as listeria, tuberculosis. There are other neurodegenerative causes, Alzheimer's and Pick's disease, and many other different metabolic disorders such as acute intermittent porphyria, etc. can cause this syndrome, but important to consider a wide range of metabolic and infective processes if your patient presents with this syndrome and the clinical scenario fits the picture.